Is Ozempic a miracle weight loss? Firstly, with over 35 years of experience, from bariatric surgeries to all laparoscopic surgeries, you've seen it all.
Can I tell you which is the most important
Yeah,
change
please.
in the last few decades?
Yes, please. And also, as per the stats, also like the Indian obesity rates are like rapidly skyrocketing.
Yes.
Yeah.
I don't know about other things, but in this we are traveling in a rocket.
And is childhood obesity increasing? What are your thoughts on childhood obesity?
Yes. So now we have a new subject, childhood obesity. It was never there earlier.
Can
Yes.
you take us through the different types of bariatric surgery that are out there,
Yes.
and the safest or the best and easiest way to the most complicated way?
So whenever a patient comes to me and they say, yes, you need surgery, so they immediately say, so liposuction.
Yes.
So that is how they have, because in their minds it is like, oh, I have a lot of fat and I need to remove the fat.
So this is called as, what is the name of the procedure?
Intragastric balloon.
Intragastric
Insertion.
balloon insertion.
That every patient who comes to me with this, I want to see them fit and healthy. I want to see them lead a very healthy and happy life. Live long enough to remember me.
I think every doctor ultimately strives on that.
Yes.
Yeah.
But I work on that.
Hello everyone, welcome back to Yours Holistically. So today's guest is Dr. Anil S. Mehta, a senior laparoscopic surgeon with over 35 years of experience in the industry. As a founder of Anil Mehta Surgical Clinic and now a brand new medical experience center called Serene Med Launch, he has transformed countless number of lives through his bariatric and laparoscopic surgeries and helped them gain their confidence through their weight loss surgeries. So we are going to be deep diving into obesity. Is it a choice or a disease? What are the various lifestyle factors that leads up to obesity? What are the treatments, surgical and non-surgical options available to treat obesity holistically? Plus the real deal on Ozempic. Is it a magical weight loss pill? We'll get to know the facts. In this episode, we've also touched upon obesity in children and what is the real cause. So Dr. Mehta, welcome to Yours Holistically. So glad to have you on board.
Thank you so much. It's an honor to be here.
Thank you so much. Firstly, with over 35 years of experience, from bariatric surgeries to all laparoscopic surgeries, you've seen it all.
Yes.
But before we start and deep dive into obesity, bariatric surgery, Ozempic, and non-surgical interventions, I would want to know what makes you wholly and truly you. So this is a segment called as 360 degree of you. So we know the professional side of you, but there is always different sides of a person that is not always in the public eye. But you'll have to spill the tea here to help us get to know you wholly.
All right.
Yeah.
So I can begin with my birth. I was born in Rajasthan and I was 3 years old when I came to Bangalore. And ever since, I'm a Bangalorean for more than 50 years now. Did my schooling in Bangalore. I did my medical school from Bangalore Medical College. Did my master's in surgery at Mumbai, Nair Hospital. And I did my FARCS from Edinburgh, UK. Post-MS, I joined Kidwai Memorial Institute of Oncology. Was there for more than 2 years. So I have a lot of experience with surgical oncology as well. Then I joined Ramaya Medical College as a lecturer. And I was there for more than 3 years again. One thing at Ramaya Medical College was that I loved teaching, and that really, came out well there. So, and ever since I've been teaching whoever comes in front of me, and whoever is interested in learning.
Yeah,
I don't speak to walls.
Good decision there.
So. Post that, I jumped into private practice because it was too much to manage both medical college as well as private practice.
Yeah.
I sometimes used to begin my day at 4 a.m. in the morning, finish the surgeries, reach the college by 9, finish by 5:30, get back to consultations, Post that I would do the surgeries and reach home by 11, 12, 1.
I'm getting tired just listening to this routine. I don't know how you did it, but amazing work. Yeah.
Yeah, so I also got tired one day.
And then you thought,
That is when you will see now the other side of me. So I was fully into the profession, and then, it happened once that my daughter asked me, Papa, what is this Havelis? So I tried to explain to her, okay, it's like this. Havelis are very famous in Rajasthan.
yes, yes.
And it struck to me, this is not the way to teach a child. I need to show them.
Show them.
So
Travel.
that summer holiday was my first, travel. I took 2 weeks off, and
How?
yes, I said nothing doing. We are doing that. 2 weeks off. It was more like in a caravan. We were in a vehicle, traversed through Rajasthan for 11 days, and then came back. I showed her what a Haveli is. And I thought, yes, now this is the beginning, and I'm going
That's
to
so
do
sweet.
this every single year, and we did it.
Wow. I think traveling was not a thing back then. Now it's
Yeah.
become like everyone is taking a long vacation
Correct.
and one short vacation or multiple small
Multiple,
vacations.
yes.
It's becoming a thing now. But I think back then for you to do this, especially being in the field you are and the kind of busy
Yes.
practice you have, even now. So we did a 2-week Rajasthan trip 2 years back.
Yes.
And now every summer vacation we want to do that. Even now with like taking 20 days break, I think 10 times like what's going to happen to my practice. For me, it's all scheduled. But for you, I think surgeries can't be.
Yeah, but I think one thing
very
that
important.
I realized very late, and I want others to realize it much earlier, that nothing happens to your practice. If you're good at your work, people will
People
come.
will wait and come.
And unless it's an emergency, they will certainly wait. And that's a test. When I did that, I realized, yeah, I really didn't lose. Only thing is that as soon as I came back, I was very busy for the next week or so.
Oh.
And then it came back to my schedule. So this is something that was actually a very good learning. And I should thank my wife for that, because she really pushed me into making me understand that life is not only profession. So while that is on one side,
May I
the
ask
other-
what your may I ask what your wife does?
So she's a homemaker, and she is also my boss, because now she owns our places, and I work for her.
Good, you have a good boss, I'm sure.
Oh yes, I have a lovely
Yeah.
boss.
That's
And
wonderful.
apart from that, then we also started taking breaks, short breaks, and actually getting to be a little more social. And then I saw that I actually missed a lot of things.
But I think
lot
you
of
realized
life.
it very early on than most
Yes.
practicing doctors. They realize it very, very late.
Very
At least
late,
most
and
them
some
told
of
me
them never
Never,
at all.
yeah.
So I really want to tell all the doctors, first of all, our profession is such where we lose our youth, but at least we should make an attempt not
Wonderful.
to lose, or at least maximize the amount of non-professional, times that we can spend, particularly with family, and especially with spouse and kids, because spouse is going to stay with you all your life,
Kids are
and
gonna go.
kids, I think it's very pertinent that if we spend time with kids, then we can expect them to spend time with us when we are old.
True.
So when we don't do it, and then we expect that they
Then-
should, I think that's asking for too much.
But amazing, doc. This is something very few doctors. I've spoken to many doctors, and everybody says I've missed out on this. But I think you've
No.
caught it at the right
I
time
caught
and
it,
did
I
it.
caught it.
Yeah.
And I made it
Wonderful,
up.
Wonderful. But I can also see the bond that you and your son share, and it speaks a lot about how much, it talks a lot about how much of family time you've taken out, and the bond is
Yes.
just amazing.
The other thing is that we should also build up a team whereby we can help young surgeons grow and at the same time ease our life. So we can have a team of young, energetic, surgeons with you, and to add up to them our experience. So that makes a lovely team, and you can do a lot of much more amount of good work than what you can do as a
Yeah.
single person.
True.
And other than this, yes, it is some amount of sports, music, and I think that's it. Entertainment, yes.
So, Doc, if you were to be described in 3 words by your family or friends, what would those 3 words be?
I think we should ask them, no?
No, but what do you think they could be? Loving is something that I can only sense that you
Yes.
radiate that kind of positive energy and warmth.
Yeah.
So I think loving, caring.
Loving, caring is
Yeah.
there.
Yeah.
And being a perfectionist. So it comes with both
I know I'm that.
positive and negative.
Yeah.
But I think we're a family of perfectionists. So we always, we like our own perfectionism, but not others.
I can't relate more to this. And one more word. One more word.
One more word. I think being happy.
So happy, caring,
Yes.
perfectionist.
So I think being happy is very important. First one is that we should ourselves be happy, then we can make others happy.
True.
So we should work towards both.
You can't pour from an empty bottle.
Perfect.
Yeah. Okay, Doc. Wonderful. Really, it was. I don't know. It just felt like I'm chatting with a friend. So again, like I said, because you radiate that kind of warmth and energy, it's just so easy to chat with you.
Thank you so much. But this is the compliment I hear from my patients.
I'm sure. I'm sure. Okay, Doc. So now let's deep dive into your expertise, right?
Sure.
First about obesity, right? Okay, so I'll straight up ask you, is obesity a choice or a disease? What's your take on obesity?
Yeah. I think it is both, but it is mostly a disease. I don't think there is one single individual who wants to become obese.
True.
And if you observe all around you, most people have become obese despite their efforts. Maybe some amount of laziness. We'll keep, it's like exceptions to the rule is always there. And I would say choice is a little more than the exception to the rule. But it is mainly a disease. And why I call it a disease is that you will, even though you have all the right ingredients for a healthy life, you could still be obese. So what does that mean?
Yeah.
It means there's something beyond being our choice. And there can be, the reasons are plenty. It can be starting from genetic to our lifestyle, our other medical conditions, which can again add up to fat deposition and obesity. And there are environmental factors. Where you live. When I say lifestyle, of course it's the food, but more important than food is the amount of physical activity. And when I say genetic, it's a lot to do with your metabolism. Each one has his own rate of metabolism.
True.
Each one the body has its own way of dealing with different components of food. It has its own way of metabolizing the food in the muscles and liver. So there are just too many variables to say that someone is becoming obese only because of choice. Yes.
Yeah. So mostly you're saying it's a disease.
It is
or
100%.
and genetics.
100%.
Right. So can we touch upon the lifestyle factors? So we'll also get to the disease component of it, but what are the common lifestyle factors? We've spoken about sedentary lifestyle.
Absolutely.
And food choices, obviously. Are there any other lifestyle factors that can contribute to obesity?
I think the most important cause of obesity, can you just go back in time and see, did we have this percentage of obesity earlier?
No.
Can you think of why?
I think it's more to do with sedentary lifestyle, less of intense physical work. Though I personally feel that though we are hitting gym, it's not the level of physical activity that one used as a farmer used to do,
Correct.
or even like housewives back then had a lot more physical activity to do. I saw my grandmom doing a lot more as compared to the mixies and grinders that have come into our kitchens and reduce
Absolutely.
the activity. I think that is one factor.
Yes.
And also, this is very interesting. I was reading an article which said that, okay, a lot of people misconstrued physical activity or sedentary lifestyle. They think I've hit 1 hour of gym. They think I'm very physically active, but the rest of the day they're sitting on the chair, slouching on the couch and working from home. Or so the sedentary lifestyle is also very misconstrued. Physical activity is misconstrued. Yeah, so I think physical activity is a major contributing factor now.
Can I tell you which is the most important
Yeah,
change
please.
in the last few decades?
Yes, please.
Stress.
Stress, absolutely. Can't agree more. Can't agree more. Yeah.
I feel the most important factor for obesity today is stress, because when I go to all these individual causes of obesity and then go further why these have happened, it will finally take you to stress.
Good one, that point.
So in my opinion, that is the single most important factor for obesity. And it's just not obesity, it's you take any disease, I think
It is the
it
root
will
cause.
find the root cause. You will go down to stress. And the kind of stress that we are in today, it was never, when you speak about grandmother and their parents or ancestors, they didn't carry this kind of stress. They were never in a rat race.
Yeah.
They had a beautiful life, very consistent, morning to evening. And you remember that gutty piece now?
Yes, that's what I was going to say.
Wonderful exercise. Today, in the gym, they make you, different. They break up into different components, still
yeah,
make you do that. So this is how the life has changed in the last few decades, and resulting in stress causing each and every
Yeah.
other factor, and those factors in turn
Cause
causing obesity.
it's not just obesity, no, it's all lifestyle disorders are creeping on very early. It could be
Yes.
diabetes, heart attacks.
Yeah, now we are seeing that
Yeah.
young people suddenly collapse.
Yeah.
And just not collapse. If you have gone through the post-collapse treatment part, they just don't respond to it. They don't respond. It's not easy to
Recover.
resuscitate a young patient.
Stress could be primarily the cause.
No, stress is primarily, but here I think there are too many other factors which
that-
come in, and then there are a lot of factors. I think when it comes to diet, I'll speak some more
Yeah,
about it.
We will get to that.
Yes.
So you're saying so sedentary lifestyle, stress
Yes.
are some of the most important
Diet.
and other factors that are leading to obesity.
So other than the genes that they carry, it can be some of the medical diseases, like you have a hypothyroidism, thyroid issue. If you have something to do with your PCOD is very interesting. Obesity causes PCOD, and PCOD worsens obesity. So it's such a cycle which is, it just it takes its
Hard to
own
break,
course.
yeah.
And there are say Cushing's syndrome to do with your adrenal glands, and we have found many other markers which can help us in understanding whether a patient is going to really be able to what kind of treatment they might respond to. So we are working on a lot of trying to identify factors which can help us prognosticate what might be the course of obesity if left untouched, and in case we use different kinds of treatments, what we might expect as outcomes.
Okay. So what are the long-term, suppose it's beyond weight and beyond aesthetics, what are the dangers if obesity is left untreated?
Yeah, plenty. This is one question I can just rattle off the answers, because it's so many.
So many, I know.
So you start with diabetes, hypertension, thyroid. You have PCOD, PCOS, infertility, And you can have hyperuricemia with joint pains, you have osteoarthritis because of weight, and you have breathing issues, you have you know, cardiac issues.
So
And
pretty
yeah,
much
plenty,
every organ is
organ is
affected, and the
yes.
overall quality of life is affected if
Very
obesity is
much.
left untreated.
Absolutely.
Yeah. So there are people. Is it true or false that somebody is overweight and they're active? Is it equated to being healthy? Because now we see a lot of plus size influencers coming in. Some people are doing really amazing work in putting out good content, but there are also people who are trying to normalize overweight. So what is your take on overweight but having an active lifestyle equating to health?
Right. So I'll tell you this, put it this way. Yes, they are overweight, fine, and they are very active, which is also fine. So what does that mean? It means presently you're good. Presently. Now let's say you continue to be active in the same manner and you continue to remain overweight in the same manner.
Okay.
What happens few years later, a decade later, 2 decades later? The excess weight is always a burden on every single organ of your body. Your heart has to pump more. Your liver has to work more. The kidneys have to work more. The only organ that does not get affected is the brain. Every other organ has to work more. But when I say your brain is not going to get affected, that's only chemically. But stress will affect the brain. So it is good for now, but you cannot say it is going to be good forever. That is, I think that is the point that one should really understand that yes, you're good for now, but you have to aim at coming down to a normal weight. In fact, if you ask me, as we age, beyond middle age, beyond say 50 or plus, ideally we should be losing some amount of weight every year, because we should match the effort required by every organ to maintain the same homeostasis.
Correct. Yeah, makes sense.
So losing, a few 100 grams or a kg or something every single year, I think it's very good for our body.
So okay, now we take a hypothetical situation where I am on the heavier side.
Right.
What is the good start point for me? Like, how do I know whether I'm healthy, not healthy? What are the parameters I need to check, and how do I start? So we have BMI, which was the widely used measure, but now we are all moving from BMI to fat percentage.
Absolutely.
Because that's more accurate.
Correct.
So can we talk a little bit about BMI? Because still most of them know about BMI, but still people are not looking at their fat percentage, which I think is more important measure. So can we touch upon that? And yeah.
So BMI has been the something that we started with when it came to obesity. Another reason is a very simple calculation. You need your height and weight, and you have the BMI. It still holds good as a screening test. It gives you an idea about what it is.
Yeah.
But if you really need to know, then we need a body composition analysis. Now that will give you the amount of lean body mass, the amount of fat percentage. It will also give you the segmentation of that. So which part of our body has more fat and which other area has less. And it also tells you what is the quantity of body percentage of water. And when we put all of them together, we can then understand whether this person, is he obese as a whole or has more of a central obesity. Now the central obesity is something that is even more relevant today, particularly in those who have other comorbid conditions, like I mentioned, diabetes, BP, cholesterol, thyroid, and a lot of the issues. Now, when I say central obesity, it is not the fat which is underneath the skin. This is the fat within the abdomen, all around the abdominal organs. That is the metabolic fat. And when we say metabolic fat, it means it is responsible for the metabolic conditions which can put us into a lot of health issues like diabetes, BP, uric acid, cholesterol, everything. Now, that is actually called metabolic syndrome. So you can have obesity alone or obesity with metabolic syndrome. You can have obesity and you may be prone to metabolic syndrome. So when you look at someone and if they are generally, uniformly have fat distribution, they may not be so bad. But those who have more of central obesity
are at higher risk.
Yes, high risk.
So how do I measure? So BMI is pretty straightforward, but how do we measure fat percentage? What are the tests one can get?
So this is called as a body composition analysis. That has also been simplified pretty well now. It almost comes like a weighing machine, but it gives you all these details. But if you really want to get the correct picture, then it is an MRI, which will give you the perfect, picture about what kind of fat. I mean, more than what kind of fat, it is where the fat is deposited abnormally. So you can then plan what should be more appropriate.
What about DEXA scans?
Absolutely. So DEXA scans and these body composition analysis, BCAs, MRI.
How frequently should one get these done to keep their health at check?
I would say as lay people, it's better to just stay with BMI. And beyond this, I think if you feel that the BMI is more than normal, one, or if you feel that although BMI may be normal, but certainly I don't look healthy, something is wrong, I think that's when they should see a doctor or a specialist who will then should decide what can be done. But body composition analysis today can be done like a screening procedure. I mean, you can just go walk in and get it done. And that will throw more light, because today information is the one that gives you more clarity and more stress.
True. The more you know, the more you're stressed. Sometimes ignorance is bliss.
Yes. The more you know, because it's an incomplete information and knowledge. So that's when you get stressed.
Nowadays, that's become a major, it's like a pandemic, because everybody seems to know a lot more than they should. And I think that's becoming very detrimental, because now one of the scariest practices is supplementation. People are popping in these supplements like peppermints, not knowing what it is doing. Sometimes the supplement is going to be counterproductive and it's going to cancel out the other supplement. So, like I said, it's a very detrimental.
Absolutely.
So, how much does it cost, Doc? Like, if we can talk about the cost, if somebody wants to get their body composition analysis done, what is the average cost that we're looking at? Yeah,
so you again have various equipment which can give you a lot more, units and measurements. I think it should cost you around 2,500 to go up to 7,500 or 8,000 maybe.
Okay, so it's doable.
It's doable. It's not. I mean, once a year if you're doing it, is worth it to. It'll open up your eyes as to where you stand.
Yeah.
So nothing like looking into your body.
Yeah.
That makes a lot of.
That will also help you with curating your exercise and diet plans more mindfully.
Yeah, many times it is more motivating because you know that, oh, I need to do something.
Yeah.
So I don't know how long it lasts, but at least.
Yeah, consistency is becoming, again, another major problem. Okay, so I feel I'm overweight. I get, and I try to analyze the causes. We've discussed the causes. And then if need be, I need to look into the body by doing certain tests. And then what should I do?
So if you fall, now let's take BMI because very simple. So if your BMI is within normal range, say within 24, then you should be happy. And if you had any stresses related to this, throw it out and be ultra happy.
And go and eat that biryani.
See, you should take a call. If you eat biryani today, your next test may be abnormal. So
okay. Don't celebrate, but don't indulge.
Yes.
Okay.
I will tell you one point about that when we talk about diet.
Okay.
So now, supposing it is in an overweight range. So what's happening is worldwide we are seeing there is some difference between the genetic considerations to Indians and Asians as compared to the Europeans and Caucasians. Yeah. So what we have observed is that the level of BMI which seems to be more dangerous to the body, including the onset of metabolic syndrome, is much lower in Indians and Asians, which means that if at 30 BMI, they still consider it is within 30 is overweight and okay. While in India, now we're realizing at 27.5, they're equally prone to what a gentleman or a lady from, Caucasians are at 30. So which means that I think we need to get more cautious. That means genetically we are more prone to diseases than them. So I think that should actually, I would hope that this gives a little stress to people.
And also, as per the stats, also like the Indian obesity rates are like rapidly skyrocketing.
Yes.
Yeah.
I don't know about other things, but in this we are rocket.
Yeah.
We are traveling in a rocket.
And it's also interesting to see that it is a problem mostly with lower socioeconomic strata people.
Yes, that's
as compared
that's
to
so
which is
interesting.
contradicting the whole idea of this, right? So because you
Correct.
get foods that are processed, filled with fat more easily, and more mindless consumption is happening in that segment, which is why the obesity is also on
I
the
think
rise.
it's more to do with more access with easy money possibly, or I don't know how I should be putting that. I don't have an idea, but it is. And along with that, the genes.
Of course.
So you have, or possibly that the more educated they are, we assume that they are a little more careful. I really don't know. I mean, we don't know really where we stand. But yes.
Because I also feel that sometimes the foods that we're talking about could be slightly expensive, the more healthier version, sometimes I'm talking about. So once after a long day, you quickly go to this Maggi stall or just fast food centers and quickly grab something that is very high with the fat and unhealthy processed food, which is
Absolutely.
making this obesity a bigger pandemic in India.
I think rather than saying easy money, I think getting food easily at less money.
Exactly.
I think that
lesser cost
and easy
because
it's so easy to live in Mumbai, even with 10 rupees in your pocket.
Vada pav.
Yes. And I'm sure here also the same. The way the there's food yes, food. You get your full meal for really less.
Yeah.
So I'm sure it will be
That
all
is why,
adulterated
I
or
feel.
whatever.
Yeah. Okay,
Quite
so
possible.
we do the scanning and then we were at what step now? So then you realize, okay, now I'm not on the healthy weight.
Yes.
And then you change your diet, you get into exercise. If your obesity is not gone to a level where surgical intervention or some medical intervention is needed, if it is within your capacity to improve, you do that by changing your diet and exercise.
That's
The
right.
biggest question is, doc, I'm doing everything. I've changed my diet, I'm working out, but I'm still not losing weight. Where why does this happen? Where are the scenarios we see that patients are struggling to lose weight in spite of doing everything right?
So two issues in this. One is that yes, if they are doing everything right, they are doing everything right within the limits of their knowledge.
Right.
They may be still making some mistakes.
Right.
So when I get a lot of patients, in fact, what's very interesting, I get a lot of patients who are in that range where they don't need a bariatric surgery and they want one. And those who really require, they say, no surgery, tell me anything else. So there's something I'm not able to figure out still why this is happening. So that apart, I just remember to say that. So when they're doing everything right, let's assume they're actually doing everything right.
Right.
Then I think that is when they need to come and see me.
True.
So it means see a specialist who can then look into the other causes of obesity.
Right.
You need to do a detailed workup. First, take the history in detail. As you rightly said, someone may hit the gym for an hour, but the rest of the day is worse than a normal average person's life. That can be bad.
Yeah.
Or they may eat well, eat healthy food, everything, and they may on a Sunday or someday they may just make it up, binge in such a way that it is more than what,
Cheating.
that's a very big cheat. So these are some of the factors. Medical causes need to be ruled out, and we should look at one more important aspect, and that is, what is their mindset? There are a lot of psychiatric issues or psychological issues which can also result in being overweight or obese. And I think that also should be
Can we
always
touch
looked
up
in.
on that a little bit more? Like what are the
Yeah.
issues we are talking about?
So, so we'll go back to stress. From stress, if they are able to cope, they will do things right.
Right.
If they are not able to cope,
Succumb to
then succumb to it. Depression is the next. And in depression, most people binge eat, binge shop. Very few people stop eating. So when most people start binge eating, then again you end up with this, because it's not just binge eating. They will also be physically very, very inactive. This lifestyle becomes even more sedentary because they may not be able to cope up with their work. They lose a job. Everything starts pushing them towards a corner.
unhealthy lifestyle.
And that is an obesity corner. So you have to look at a complete individual, his environment. Also, I always keep an eye on the relatives who have come along, the attendants of the patients who have come along. Many a time I ask question to the patient, and my answer I look at their attendants, because you get the right answer there.
Correct.
So these are the things we should, this experience has taught. Books will never teach us that.
True.
So when we start looking at every single component, we are very likely to
Figure out
identify
why.
where it is going wrong, help them out. And once we can, and it's very important, one other thing that's important is, it's not enough that we identify and we tell this is the treatment. I think in today's scenario, where a patient is also well informed and with enough knowledge, maybe half, but still some information in their minds, it's very important that we make them understand. We have to give a clarity to them that what we think is wrong, why is it wrong, and why this treatment is going to help. If that clarity, see, wherever there is a clarity in one's mind, then there is no more room for any other influence to the, otherwise all the patients, relatives, friends, WhatsApp groups, Google is going to erase whatever good you may try to do. So I think if we look at it in this way, in a very holistic way, that is when we can really help them.
Yeah.
It's not that you identified the problem, gave a treatment, go.
Yeah.
That never works, not at least in obesity.
True. Two very interesting points. Actually, one main point it comes down to is people around you can make or break anything about you, right?
Yes.
Especially when with obesity.
Correct.
There was one like a 22-year-old who had come to me, this was some time back, who wanted to address her overweight issues, because she also had acne, hair fall, and I was telling her that it is a holistic approach that we need to look at. And she was not, I wouldn't say she was obese, but she was on the heavier side, and she
Right.
definitely needed to work on her diet and exercise for sure. So there was her mom who used to come, and she used to get all unhealthy because they come from very far. So it was almost like a 4-hour commute, 2 hours coming then going, and so it was like almost a day activity.
Right.
So she used to carry all unhealthy food, and I'd given her a diet chart. We also have nutritionists and fitness experts on board in a program called DNA 360 that we have. So we'd given her a diet chart that she has to follow. But her mom used to get all unhealthy stuff. She said, it's okay, this once, it's okay. And everything is loaded with sugar.
Yes.
And she says it is homemade snack, which is healthy. It is loaded with sugar and ghee. Ghee to some extent is healthy, but you can't
Correct.
overeat
You
ghee
can't.
also, no doubt.
Yes.
So it is very important for you, your people around you also to support you.
Absolutely.
Suppose you are on a weight loss journey, you are following a strict diet, and people are cooking your favorite unhealthy food at home, it's very difficult for one to resist also. So I think
That's
setting the tone in your house and your environment is also very important. If
very,
you're
very
on that.
important.
Yeah.
So many a time, actually, I end up spending more time with
Yeah.
patients, attendants, because I need to correct them,
them.
to have the patient, and that is really sad. You feel so sad for the patient, because the patient has come thinking that I want to do well, and the environment is not allowing
Yeah.
the patient. So we have to deal with all that.
And the other thing that is very strongly is stuck in my head is we had in our own family, we had relatives where we used to, like, my mom was sort of like particular, like very, I wouldn't say particular, but somehow we never had that chocolates at home that was just lingering around that you can pop. So if you wanted to eat, we had to go buy. So it was, when something is not in your house,
Yes.
around you will not overdo it also.
Very true.
But there was this house where for my relatives, we opened the fridge, the chocolates just keep falling. There were sweets on the table. There was a lot of junk and sugar around, and the kids grew up to be obese adults.
Yes.
So that brings me to the subject of, is childhood obesity again is a choice? Do you think there is a role of parents in the environment in childhood obesity?
Yes.
Because I feel there are some things that has to be set tune in children, and then their habits creep onto your adulthood as well. It's very difficult to start few things as an adult. So what is the importance of environment you create as a parent in your for your children, and is childhood obesity increasing? What are your thoughts on childhood obesity?
Yes. So now we have a new subject, childhood obesity. It was never there earlier.
Wow.
So it's a new subject, because that's the numbers we are seeing. You rightly said, it is again the environment. Environment is created by whom? By the rest of the family members, because the child is oblivious to anything. It's just come.
Yeah.
So now, when you have that kind of an environment and the attitude, you see, the mindset is very important, particularly of the parents. So if they feel, oh, one is okay, you start with one and you never know when it becomes 100. That is where,
Yeah.
and the child wouldn't know what is right or wrong. For the child, what is tasty is all that matters.
Absolutely.
At this age also it matters to us, then why not for a child?
Yeah.
Right?
Who doesn't know the repercussions of it?
Absolutely.
Yeah.
So, other than genetic, I think it is the home environment, the people in that environment which really matter. I will tell you about my observation. I spend a good amount of time with my patients, because the more I understand them, it's easy for me to decide the treatment for them.
True.
Because no two treatments, however alike, however even if the patients are alike, will help. So you need to figure out what are the other variables which are going to matter. So when I do that, they get quite friendly with me, and they say, oh, doctor, my son troubles me so much for eating, just doesn't eat food. And then I have to either put on the TV or do this or give something which he likes, and then in between feed. So I ask them only one question. When do you have your meal? I'm sure you will first give your child. Said, of course. So you have your meal. I mean, you feed your child, go running behind, somehow feed, and then you sit and have food. By then the child is playing. I said, what you need to do is go back to your grandparents' time. We were not fed like that. The food was in front. If you are hungry, you eat. If you don't eat, others are all busy. So I always suggested that if you really want to teach your child to eat on their own, please take a plate, your meals, put it in front of you, see that the child is around you, and take every morsel that you take, please enjoy it and eat. The child will see you pick up, put in the mouth, pick up, put in the mouth, and see you enjoy. The child will come closer to the plate, pick up and put in his mouth. That is what we need to teach. And Well, while I was in Ramaya as a lecturer, I got a very dry subject for a particular one lecture, 1 hour lecture. A very dry subject, very difficult to keep hold of the students. So I thought I have to make it interesting. So I tried a lot, and then this was pre-lunch, 12 to 1, 1 to 2 is lunch. I started my lecture on that subject, and before we realized, it was 1:30 and not one raised a voice about the time.
Huh.
And that is when I figured out a teacher's job is not to teach. It is to make a student want to learn. Your job is done.
But how did you do that? Like, how did you make it engaging?
So you have to make it very interesting. You have to generate some kind of a something that you want to know what next, like in a movie.
Like a storytelling.
And you have to also leave a little bit untouched. There has to be something itching in their minds that now I want to know more about this. They will go read and they'll never forget. But if we teach like this, likewise, parents teach the child, eat it, they will never learn. Children only learn by seeing what their parents do, not by listening to what their parents say. So I think this is really lacking in the present generation of parents, because they feel, no, I have to take the best care of my child. In taking the best care of the child, they've forgotten that actually they are doing more harm than good. They are not deep diving into what is actually good parenting. Just taking care and giving all the best comforts, I think, is not to be done with.
So my mother-in-law comes from a Montessori background. She has a school, and she has huge respect from the entire Montessori community, and she's very good with children. So that's what she also keeps saying. You eat, you enjoy your food. Let them see that you're enjoying your food, and then they will pick it up.
They will do it. You've taught them to eat.
Yeah.
When they do it, and anyone, if you do something by yourself, there is absolutely no force, and you're doing it from within. But if I tell you, do, the first thing is why? I won't.
But Doc, there is, I am also a parent to two young kids. It's difficult sometimes when they have to finish that bowl of like nutritious food that you've planned for them, and they don't eat on time. So sometimes you have to say eat, but by and large we should try. Tell me, how do you solve that then? If they're not eating and their school bus is waiting for them and they have to be dropped off to school?
Yes,
then
I will tell you. I will tell you how. Go back to our ancestors, grandparents. They never knew whether we ate or we didn't eat.
Times were different, no, Doc?
No. I don't agree on this. See, even now, let's assume your child didn't have food.
Right.
Went off to school. Okay. But child is carrying the food.
Yeah.
Right? Now, let the child understand by not eating what is the repercussion. Now the child is hungry in the school. Can she go and ask her teacher that I'm hungry, I want to eat? And if she does, that is another new learning, how to ask, and you should be bold enough to, of course, go and say that, yes, I'm hungry. And in case the child manages somehow, she would have understood one thing, that next time, I can't do this mistake, I can't afford it. And tell me one thing, what would happen if a child missed a meal? Nothing. Except for the parents, particularly mother.
Doc, for some time, they don't even realize that it is hunger. They get cranky. They can't even process that information of being hungry. Because my older one doesn't know what hunger is. She just gets very cranky. So then what do you do?
Because you've never
I think you're digressing too much into different...
No, you have never taught her what is hunger. Before she really understands that, you have fed her.
Maybe. But
this is my close observation and interaction with my patients, so I still may be wrong, and to tell you the truth, I really don't have any experience in this because I was all the time very busy with
your
my
practice,
profession
and the
when my
boss
kids
handled.
grew up, and boss handled it all alone.
I should have
Did a
a
wonderful
discussion with
job.
ma'am once
Yes.
on how she was. Because for me, I'm like, junk and screen time is something that I'm very like particular about. So if there's no junk, they have to eat the healthy food, and sometimes it's difficult to process. And if they don't eat that whole thing in a day, the nutrition is not reaching the body. This is how
Yes.
it is my
Please-
problem.
please
I know it is
correct.
my problem.
Yes, you need to correct your thinking.
Thinking, yeah.
One day, nothing happens.
Mm.
You need to allow them to learn. Please don't teach.
So the second thing when we speak about this that comes to me is when, as you rightly said, parents will come and complain about their
Yes.
children to us. So they tell me most of the times I hear कि they're eating junk. When I say, you know, when they have a lot of acne, there are the foods that can contribute. You say,
Yes.
are you listening? Now you understand. I'm like, where is the child getting the junk from? They are taking money from you and buying, or you are buying this stuff, putting it at home. So it's
Absolutely.
accessible to them. So never blame a child for lifestyle disorders. It is on the
Absolutely.
parents to sort of set tone for a few things.
Correct.
So yeah, that is about the child
That's
nutrition.
absolutely right.
Yeah,
It
we can't
is-
blame the child
so,
for
yeah. When you ask me a question whether it is obesity is a disease or by choice, when it comes to childhood,
It
it
is
is only a
choice.
disease. The choice
Childhood
is
is-
that of parents
like that.
or
Okay.
the family.
Mm-hmm.
It is not the choice of the child.
Child, correct. Childhood obesity is not the choice of the child, but it is mostly a choice of the parents for
Yes.
not guiding them the right way.
Absolutely.
Well,
More than not guiding, not actually not maintaining themselves as good examples for the child.
hmm.
I would say more on that.
Yeah.
Even if they are not consuming unhealthy food, but it is, as I told you, if they go on feeding,
Yeah.
that is where we go
Or
wrong.
if they're making this junk accessible to the child in the
Again,
first
it's
place
wrong.
and not having strong boundaries about the limitations
Yes,
there. I
correct.
think once in a while, I think all the children, like for birthday parties and all, they indulge in the.
It should be done.
It should be done
should be
for
done.
that event. It can't
That's
be
right.
an everyday thing where you can go buy pastries and come home
Correct.
and eat. There should be boundaries that are set, as with anything, for the for the food component also. We can't think that okay, I will make more stricter decisions once they grow up older, because that is the pattern that they'll build.
Yes. And
Once
this-
they've gotten that sweet tooth, it's so difficult to.
Ask me.
About you or about your children? About your own self?
I think I have the sweetest tooth in my family.
Huh.
I could devour.
Doesn't show.
Oh, now boss is controlling.
Boss is control.
So, while we speak about childhood obesity, we have been speaking only about diet. And as I have been observing in our conversation, so every time you spoke about lifestyle, you say diet and exercise. Correct?
There are a lot more
I
aspects
think,
to it.
no,
True.
here itself there is a correction.
Please tell me.
The foremost thing should be in our minds, it is the exercise and diet.
Or the
It is what priority and importance we give to a certain point also makes a huge difference. So always it should be exercise and diet. I'll put it across this
It's
way.
very sorry,
No.
doc. It's very interesting because I just did another podcast with another doctor, and she also put exercise and diet. But for me, I work out regularly and I've been doing it for years. Even then, for me, diet and in my view, it is diet and exercise. But it's very interesting in a matter of 1 hour to hear it from two doctors to put exercise first and then diet. Please tell me your perspective
I
on
will
this.
tell you in a very simple way. You exercise and burn say 2000 calories. And whatever you have consumed is less than that. It's fine.
Right.
There should be no issues. You have burnt now 3000 calories. So even if you eat more than what you have normally eaten, it's still fine. If it's the other way, you eat and then think I will exercise. Whether that will happen or not, no one can predict that.
Yeah.
Okay? And moreover, most of the times, we end up with consuming, digesting, absorbing, depositing fat. Then we exercise. So, I will touch upon one important consideration for a healthy lifestyle. So I have a mantra which I give to all my patients, and I'll tell you why. I always say, work on a full stomach, rest on a light stomach. Okay?
Yeah.
Why? So when we consume food, I'll tell you about myself. I begin with a lunch. I never have breakfast. Early morning, whatever the time when I leave home, I have my lunch and leave. So there have been times when I've gone for surgery at 6 a.m. I've finished my lunch before that. My wife has already made the lunch even before that. And then I leave. And I'm working. I'm digesting, absorbing. The calories are being produced and I'm utilizing them. There is no way that it will go and deposit as fat. And then I can manage for hours together because I'm already full of energy. I don't feel tired. Again, what I do is I have an early dinner. So when I have an early dinner, I still have many more hours to go. I work during that time. I feel the best for a normal routine. A working lunch, working dinner is the best. You have 10 minutes time, limited food, because your mind is on work. You quickly finish and leave. But let's do the other way. You woke up fresh, you have all the energy, so you go on working, and tiredness sets in. You are hungry, but you continuously persist on your work because you want to complete something. You come back home. Then you feel, now I want to, now I have all the time. So now I recall, I want this and I want that, and I go on eating. And after that,
Sleep. And also I think after a long day of work, and when that is your biggest meal, I think you will want to reward yourself a little bit. So you're not going to be very strict with your diet as you're going to be during the daytime.
Correct. So that's the difference between a working meal and a relaxed meal. So when you do that, you are now digesting, absorbing, generating calories, and there's no work for it. No work for it.
At night.
At night.
And
so you deposit as fat. Now the next morning, again you start working on an empty stomach, and you don't have that much of calories. So do you think where will the calories come from? You have not had food. Where will it come from? You would assume that got deposited as fat.
That will come.
No. Nature's way is to always preserve fat so that it can be used for dire emergency. Right? So it doesn't touch fat. Now the first thing that goes is the glycogen in the liver, and you still need some more. Then your proteins start breaking down. Your proteins break down, give you calories. But what is the result? Your fat got deposited, your proteins got broken down, and you are now becoming obese. You're putting on weight. The fat percentage is going up. The lean body mass is coming down. Your BCA, the body composition analysis, is just going topsy-turvy.
Yeah.
So this is what is important when it comes to managing your exercise and diet, where exercise also should be done with some amount of a high calorie intake food so that your proteins are not broken down if it is a strenuous exercise. So we always say have some dates, have some dry fruits, and then start, or have a fruit. So that the immediate calorie needs are taken care of. So it is not like counting calories and eating. You will lose the fun of life by doing that. But you can have some understanding for your own body, which is for you. You can't copy someone else. Their body is different, yours is different. So that's how you should focus on exercise and diet. If you exercise well enough, your diet can automatically expand. It will expand because it will require it. Your body will require.
True.
So I always say exercise. The second is diet. Third will be anything else if you want to lose weight. So I also don't come at the top. Always exercise at the top, next diet, and then any other means of bringing down your weight.
Makes sense, yeah. Very interesting, Doc. Okay, so Doc, obesity solutions are not one size fit all, right? So we've
Right.
spoken about exercise, diet, and certain
Yes.
lifestyle modifications one needs to look into. But if nothing is helping, and I
Yes.
want medical intervention, we'll start off with non-invasive to invasive,
Done.
right? So what are the non-invasive treatment options available to treat obesity? Of course, it goes without saying, safely and effectively.
Absolutely.
Yeah.
I think that's the basic something to be underlined.
Yeah.
So when we begin, whether it's non-invasive or invasive, we need to understand that the foundation for any treatment is still going to be exercise, diet, and then something else.
Yes.
If we want to lose weight without exercise and diet, it is a very temporary phenomenon,
Yeah.
and we will go back like a rubber band back to the same.
True.
Or even worse, it may
Or even
rebound.
worse, actually. Yeah.
So when you come to non-invasive treatments, I'm sure now, one word that is all over the world, not just India or anywhere, is Ozempic.
Ozempic.
Absolutely.
Yeah.
So I think it's overused or overtried because people, I think, are taking even without
Proper
prescription. Yes, without understanding whether it is right to do at whatever stage of excess weight gain that the patient has. So that is something that I think should be purely based on the doctor's prescription. And just to understand when we can use Ozempic is, say a patient is overweight, tried everything and it's not working, and you want you're doing the best of exercise, diet, and still are stuck at a level. You want to come down on that. You can take the help of non-invasive methods like Ozempic in the form of medication tablets. You also get injectables, which can also help in bringing down the weight, so that weight can be maintained by what? Exercise and diet.
Again.
Any of these interventions, if you take it only to lose weight and then leave it, you will definitely regain back. That is one. Secondly, if the other non-invasive, which is very interesting, is that we now introduce a balloon in the patient's stomach.
Okay.
So we introduce a balloon with about 550 ml of space occupying the stomach. Now the beauty of this is that the stomach is almost always full. So many patients ask me, will I lose my appetite? I want to correct everyone to understand, whether it is a balloon or a bariatric surgery, you don't lose your appetite. There is only a very early sense of satiety, early sense of fullness. So post balloon or post bariatric, I give someone to have this much amount of food. They'll possibly take this much and say, I'm full. So that really does wonders in bringing down the weight. Now there is another component to this. The place where this balloon gets placed is in the fundus of the stomach. And there, in our whole body, there are networks all along. So, and you also, if you are aware of what is known as a gut brain, so they are always talking to each other.
Yeah.
So the messages that go, the information that goes to the brain also helps in ensuring that while the quantity of food becomes lesser consumed in the patient's body, and thereby the calorie intake reduces, there is a calorie deficit. This calorie deficit has to be replaced. Body cannot just keep quiet. So that is when the information goes to the fat cells to now, for the first time in the patient's life, the deposited fat will provide them with the calories and give them their natural level of energy. So I want you to understand one thing. A lot of patients ask, if I'm going to eat less and lose weight, why do I need to put a balloon or do bariatric surgery? It's a very logical question, right? But if you were to eat less, the signal to the brain is that I'm hungry.
I'm hungry.
You're going to fight in your brain. No, I'm not going to eat. The signal says hungry and brain says no. Imagine a fight like this between you and your daughter.
Yeah.
You will eventually give up.
Yeah,
अच्छा ठीक है वो एक
absolutely.
चॉकलेट ले ले
ले लो, हाँ.
but चुप हो जाओ बस.
At some point.
Right, at some point. That is what happens with
Yeah.
Trying to limit the quantity of food. While you look at it post balloon or bariatric surgery, I am giving you this much food. You eat just this much and say I'm full. So the brain says I'm full.
I'm full.
So the body is, brain is not troubled.
There's no fight.
No fight at all. That is why it works. So yeah.
Well, please go.
So in this intragastric balloon, now we have different ways of placing it. A lot of balloons came initially where we would have to use an endoscope, place the balloon, then fill it up, and a procedure of discomfort. So now we have something new where it comes as a capsule. And we have a special way of introducing into the stomach. I don't need an endoscope for that. And it is so patient friendly. I really love it for the fact that it is patient friendly. For me, everything is patient centric.
Absolutely.
It has to be so comfortable for the patient that they come with certain amount of stress. I don't want to add further stress. I want to remove that stress. So the patient, it's a matter of 15 minutes. Patient comes in. I have a way to ensure that the capsule reaches the stomach. It opens up. I put in about 550 ml of a special fluid and snap it off. And what happens to the balloon in the stomach? It stays there for 4 months.
Okay.
And after 4 months, do I have to put an endoscope and remove it or puncture it? No. There's a safety valve which releases after 4 months. All the fluid is out and the balloon is out the next day. So it's very, very patient friendly. And it gives you those 4 months where you can readjust your lifestyle. You have exercise and diet in place, right? Your weight which is stuck comes down. Now you should be able to maintain this. And the beauty of a balloon, it can be done several times. And supposing the patient is not losing weight or now gets a little greedy, wants to lose more weight, which balloon can't do it, they can still go in for a bariatric surgery. So it's not that by doing this, you have closed the doors for further weight loss. So that's the beauty of this, something really unique and good now. And I've been having patients from London, Canada coming for this, local from other states. And as a preparation for about 5 days and, we can manage them anywhere in the world.
So this is called as, what is the name of
Intragastric balloon
intragastric balloon insertion. What is the worst effect of this? What are the side effects with intragastric balloons? Because I have a few questions on the bariatric surgery, which I have seen and also heard from people. We'll get to that.
Yes.
But before that, from what you're saying, it seems to be fairly simple, non-complicated.
Absolutely.
I can't figure out many side effects that can come with it, especially if you're taking it for like once or twice use. Like it's not for lifelong. So, but what are the worst side effects with intragastric balloon insertion that you're talking about?
So there is nothing that comes without problems.
Exactly.
That's life.
Exactly, yeah.
So but still, this is really truly a non-invasive because you're not even taking medications.
Yeah.
If you ask me, one medication is an invasive one.
Yeah.
This is truly non-invasive because there is nothing that goes into your bloodstream. So now, what is the problems that we can face? The dangers. So if it ruptures earlier, it's not a danger. It's just that you have lost the added further advantage of the time frame of losing weight. But it is when we, the procedure, when we do the procedure of inserting the balloon, It's a capsule. It still has to go through the food pipe, traverse the entire food pipe, reach the stomach in the right place. It should be inflated in the right place. So
Yeah.
there is a technique,
Okay.
and we should be very, very adept at it, so that there, if we commit any mistake or anything goes wrong,
Yeah.
it can open up in the food pipe.
It's-
And imagine the
and
balloon opening up there. It can just rupture.
Mm.
It can cause havoc.
Mm.
So we need to only take care about the steps in the procedure, ensure that it goes in the right way,
Mm.
and there you are. It's like a walk in and walk out. It's really an amazing, invention, if you ask me. Although it's temporary.
Yeah, I think this is good intervention for people who are aiming an event and do not have
Right.
enough time and
Yes.
motivation to lose that weight so quick, but are going to be following a certain lifestyle change post this.
Hopefully.
Hopefully. I think this is a great intervention for them because it's temporary
So I've-
and
yes.
it seems to be safe. I think, but the scariest part will be when these kind of treatments are available by,
Yeah.
like how the biggest challenge we dermatologists are facing is
Correct.
lasers, fillers, injectables are being
I
done
think
by unauthorized people.
absolutely.
If this kind of treatments creeps into unprofessional hands is when the danger is. So always must look for who are the people who are authorized to do this procedure. Or can you give us the
So we go through a training session, and I think we are just a few, maybe a couple. That's all in Bangalore right now.
what are the degrees that we should be looking at for people
So
if
there's
they
no
are looking?
degree as such, but you will definitely get the the details of whether so and so is authorized to do it or not. Has he gone through the training? So the company maintains the register, and you can always reach out to the company.
Yeah.
So I don't want to mention the name of the company.
Yeah,
That's
yeah.
not right.
Fair
but
enough. Yeah.
yes, but it is maintained by them, so that it does not.
Yeah.
See what happens. They are also very concerned. If something goes wrong, their entire, the company will go flat if
Yeah.
this is the only thing they produce.
Yeah.
So they are also being very careful, and that's nice actually.
They have to do that because there was a period where there was one medical student who died because of hate transplantation, and it took us even now we have patients coming and asking about that particular incident, like you also have with bariatric surgery, because
Plenty.
there are few people who died on table. We'll again, like I said, we'll
Yes.
get to that, but I think it's very important for one to do their due diligence, see who is providing this treatment, and go to the right
Yes,
hands.
Correct.
Doc, we've not fully spoken about Ozempic in depth because
Okay.
right now I think that is the topic everyone wants to know more of.
Right.
So how does this work? How long should one take this, if at all, if somebody is on Ozempic? What is the best part that comes with Ozempic, and what are the worst side effects that people are not aware of? Because everybody feels like this is just any other supplement you take for weight loss.
Oh yeah.
It has become that now.
Good that you have raised it in this format, because I also didn't think so much in that that viewpoint.
Yeah.
See, the people should know that this is still a medication, and which goes into your bloodstream. It goes and affects various organs. It is not just. It's not that you take this and it only goes to the fat cells,
Fat,
burns them, and get rid of
Yeah.
the fat. No, we've not found anything like that. Now, these are the ones, they come with their own side effects. Before I go on to that, how is it used? Of course, it is used on, we take a certain dosage in the first month and gradually step up and stay there for a while until we get maximize the weight loss. Once we feel it has plateaued, we further go up in the dosage. And there is again a higher limit where we stop. That is the stepwise escalation of the dosage of the tablet, so that we can achieve the maximum weight loss. Now, what are the side effects which we need to be worried about? One of the most important one is acute pancreatitis. Yes. I have also used for my patients when required, and I've seen some of them get that. So it is really, pancreatitis is one of the most excruciating, painful condition for anyone to have, and it does not settle down easily.
Yeah.
It takes months and months to settle down, and you would always regret if you know what is the cause for it. So one has to be extremely careful. Under medical supervision, at least it will be identified much early, so that the moment it begins, we do certain tests, confirm, get rid of the medications, and allow this to heal as quickly as possible. The more severe the pancreatitis, the longer it takes to
yeah.
settle down. So the milder it is and it is identified quickly, at least it will settle down fast. So that is something, it is, people are also trying to buy it illegally.
Yeah.
And that is actually disturbing, because they are just seeing one side of the story. They're really not seeing what are the other problems that it can cause.
Yeah.
And this one condition is enough to dissuade anyone from taking.
Yeah.
And I think it's really, really important that we should not play with our own bodies.
Yeah, absolutely. So, Doc, with Ozempic, how soon can one see weight loss, and how much of weight can be lost in a period of time?
So you can see, in fact, even in the first month, you will see some amount of weight loss. So that motivates you, encourages you to further keep going on it and increasing the dose. But on an average, we lose, say, about 5% of body excess weight with Ozempic.
In how much period of time?
Maybe you will see that in about 2 months to 6 months. But usually it's just that much.
It's not too much, because that is what is being shown now. A lot of celebrities have drastically lost so much weight in a short period of time, and everybody's putting it on as Ozempic. So is Ozempic a miracle weight loss pill?
Definitely not.
Not. Okay, so...
You should also know that Ozempic was actually a drug for diabetes. And they found this side effect. So we are now using it for the side effect.
Yeah.
So whenever you make a drug, you have a main effect, which is huge, and you have smaller side effects.
Yeah.
So what are you doing now? You're only a small side effect. You're going to get only that much, achieve only that much. So if someone is saying that they're losing, then there are many other factors which has helped them, which they may not be saying, but certainly it can't be just Ozempic.
But Ozempic will definitely play a major role in losing the weight.
Yeah, but to what extent? 5%.
5% only.
Which is, so supposing you are 100 kgs, you can expect to come to 95.
It's not much.
This is something that I think people should understand. Is it really worth?
Yeah.
I think that much you should be able to do it by just exercise and diet.
Yes. Yes. So if suppose someone is starting off on Ozempic, for how long are they supposed to take it? And if they suddenly stop, what's going to happen?
So if they start on Ozempic, they will lose weight and maintain for as long as they take. Once they stop, they are likely to regain back unless they go very strong on
lifestyle.
exercise and diet.
Makes sense. So you're saying Ozempic is not a magical pill, but why and how are the celebrities losing weight so quickly? What is helping them?
I think other than Ozempic, one thing that I have found as a common factor is diet. Particular types of diet which are quite drastic and they help in patients losing weight. One of them is the very, very famous keto diet. A lot of people are actually losing weight because of that. But I have just one concern in this. What is a keto diet? It's a diet which causes ketosis. What is ketosis? It's an abnormal condition in the body. So do you want me to say that I am ready to go into an abnormal condition or a disease to lose weight? Am I ready for that? I wouldn't.
Yeah.
And ketosis it produces a very acidotic environment in the body, in your blood. So there are instances where people in keto diet have suddenly collapsed. Now the worst thing is that such patients, you're not even able to resuscitate them because none of the measures, resuscitative measures, which are as a reflex mechanism by the body, or what we do as medical professionals like resuscitation, will help them. No drugs help them because they don't act in that acidic environment.
Yeah. There should be a certain pH for the medications
Yes,
to act also.
to act. So, just because you are seeing very good results, I think jumping into a sea or ocean doesn't make sense.
Yeah.
And you don't know for each individual what is the limit when it is going to be harmful to me.
Yeah.
I do not know. So to each one it is different. Someone says, I did for so long, I lost and I'm good.
Yeah. You'll never
Good for
know.
him or her. It may not be the same for every
you.
single individual.
And
so
each time also it could be different.
And each time it could be different. So I think somewhere if it's not just Ozempic which might be helping them, it will be many other things which are possibly unsaid.
Yeah.
That's it. But it has to be many other things that are playing a role. And I'm sure exercise is the key thing which definitely they all work on. I've seen that in the celebrities, they really work on that. Maybe sometimes they overdo, which again becomes as a question mark. So I think most important message I want to give to the lay people is that just don't go blindly with what any one individual says.
Yeah.
Whether celebrity or not is not the point. Any one individual says, because they may just be giving out their own experience.
Yes.
It may not serve you the same.
That's what I tell to my patients also. Even if a doctor gives you an advice, or even if your dietitian, nutritionist who has not been associated with for a long time, if you're first time going to the nutritionist and they give you some advice also, process that information.
Correct.
Take all the information, see what is working for your body, because nobody knows your body better than you do.
Absolutely.
And nobody can give you a diet plan or a fitness plan, which you will be the better judge to see if that works for you or not.
Absolutely.
Yeah, and I think Ozempic is being given a lot of credit because a lot of celebrities, like in the likes of Karan Johar, you see that overnight, it's almost like overnight that they've lost a lot of weight. That is why Ozempic is given all the credit. But even now, it's just a mystery on how they've lost it so quickly.
I think there is a lot behind the mystery.
Definitely
not only Ozempic.
yeah, definitely not Ozempic. At least that clarity
not
we got
only,
now.
I would say.
Yeah, because even like every day I have patients who come and say, Doc, do you prescribe Ozempic? I want to put myself. It's not that they're overweight also. It's just that they feel like they can lose weight, they can be more toned.
So they all want an easy way out.
Easy way out. Correct.
So that's the reason my bottom line is that anything that comes
easy
to reduce weight, it comes only after exercise and diet.
Yeah. So that brings me to the question of bariatric surgery. Of course, it is an intervention, surgical intervention to lose weight and to maintain a certain weight. Am I right? Or
yeah, while you're right,
there are some.
This is the so I get patients who want to lose weight. So you will be surprised that my first counseling session, which I spend my time for, that is that you are having a wrong goal and a wrong direction.
Yeah.
Let's say the moment you think of losing weight, do one thing, just go to Google and say, how do I lose weight? See what comes up. You will have umpteen number of diets, powders, liquid, tablets, and a lot of things which will come up. Let's assume you consume that. You lose weight. But what comes as a side effect? It is weakness. So now you have another choice. Now I will correct your goal and see whether that path is good. So I say, you look at or type in Google, how do I become more fit and healthy? Now see what are the answers you get.
Very interesting prompt.
right?
To get the right answers. Yeah.
No, because we need to make them understand where they're going wrong.
Yeah.
So my first consultation, my first session with them is to correct them in what they're thinking. If you are having a wrong goal, the direction is wrong, you will end up as a disaster.
Yeah.
So my first job is, I tell them, your train is off tracks. I'm now going to bring it on track. So by the end of the session, I ask them, what do you want to do now? So still, because it's so new, I want to lose weight. I said, sit again. Yes.
Let's get your goal straight first.
Goal straight.
Yeah, that's
so
very important.
when you attempt at becoming more fit and healthy, what is the side effect? You lose weight as well.
Yeah, of course.
But you're more energetic. You're not weak. So that should be our goal.
Yeah.
So yes, bariatric surgery helps in losing weight, not in making you fit and healthy.
Yes.
But it is my personal goal that every patient who comes to me with this, I want to see them fit and healthy. I want to see them lead a very healthy and happy life, live long enough to remember me.
I think every doctor ultimately
Wants that.
thrives on that.
Yes.
Yeah.
But I work on that.
Wonderful, doc. Wonderful. Because it's so now coming to bariatric surgery.
Yes.
Who can get it done? What is the right kind of BMI? So I'm asking you all questions together, so you can go on to give me a complete information guide on bariatric surgery. So who can get it done? What is the BMI or the fat percentage I should be looking at? Pros, cons. Because I have seen in my close circle 2 people getting bariatric surgery done. This was way back, even before I became a dermatologist, I think. So I had very little understanding of this procedure. I've seen both of them succumb to a lot of nutritional deficiencies because they're not able to consume the amount of food they were able to consume, so there's a lot less nutrition that is getting into the body. I've seen them having major hair fall, their skin health deteriorating, and they were very weak all the time. And they, in couple of months, they went back to their previous appetite.
Right.
So is bariatric surgery a permanent solution for weight loss or weight management, or is it a temporary fix for weight loss alone?
Nice. So we'll start from the beginning.
Yeah.
When is the patient fit or fits into the criteria requiring bariatric surgery? So we have certain standards that if a patient has a BMI of more than 35 with no comorbidities, yes, he will do well with a bariatric surgery, and that's almost always the only hope, because it is way beyond the nature of reducing weight by exercise and diet alone. If it is 32.5 BMI with comorbidities like diabetes, BP, thyroid, cholesterol, heart disease, breathing problems, obstructive sleep apnea, snoring, hyperuricemia, infertility, PCOD, plenty. Then any one or two of them, then yes, still the criteria fits into for a bariatric surgery. As I told you, in Indians and Asians, we are now moving 2.5 below. So we moved to 30 and 32.5. And now there is consensus that possibly we may have to reduce further. But we are sticking right now to between 30 and 35. Okay, so that is one thing. So when you have that kind, plus when you have the kind of obesity, I told you, more of obesity, the central obesity, yes, then you should lean more towards bariatric surgery. Okay, and it is not just that you should have only certain criteria like this. Age is another criteria. So again, we have a standard between 18 to 65, but it is not an absolute criteria, because now we are doing many childhood obesity. We are tackling with bariatric surgery.
So you're doing bariatric surgery even on a child?
Yes. You have to do it when it is going beyond. And it is going to affect the other organs, it's going to affect the patient's entire life. Quality of life, and particularly the psychosocial. I think today, that is one of the major factors. Anyone who looks at someone looks in such a judgmental way, you know, looking up, down, all around, and then going right up to that person and giving a suggestion.
Yeah, muft ka gyan on the face.
I always tell my patients, anyone wants to give you gyan, tell them I charge 1,000 rupees. Sahi ho jayenge. That's the best way to keep them away.
Yeah.
So, it is not just the BMI or the central obesity or the comorbid conditions alone. You should focus on the patient's mindset, the fact that patient is already working towards exercise, a healthy diet, and ensuring that they are able to manage the stress well. I tell all of them, they say, I have so much stress. I can't do anything. I said, let's exchange places. Do one surgery and tell me what is the kind of stress. So we have a patient who is under anesthesia. Anything can go wrong. That's one of the biggest stress.
Yes. The human life in your hands.
Human life in our hands. So it is not that. So I agree. Everyone has stress. The question is,
and
have you learned to manage it? Please focus on managing stress. So we need to tackle stress of the patient, clear up all the unnecessary thoughts in the patient's mind, the family's mind, so that everyone can come on the same page and they can actually contribute by encouraging, the right things, the right attitudes, the right lifestyle changes as a whole, not just pushing one individual to that.
Yeah, it's very difficult.
And many a times when we do this, I along with this kind of a history, the detailed history that I take, it's a detailed examination, a detailed workup to ensure there's no other medical issues. And also to put the patient through counseling or a psychologist or a psychiatrist, intervention if required. And ensure that once you have corrected all this, or at least brought it into focus, now let's move at giving the patient the benefit of losing weight in the background of everything else coming close to normal. That is going to make it permanent. If we do just the surgery to lose weight, patient will lose weight and will regain back. So then it becomes temporary. So the effort that we put in as preparation prior to surgery, I feel decides
the outcome.
The outcome.
Long-term outcome, actually.
Yes. So this is about bariatric surgery in general. Now, you mentioned about how you've seen some of your relatives closely. And you also mentioned this is probably more than a decade ago. So
Sort of.
Okay. In any case, in the last few decades, we have had many innovations coming our way. Laparoscopy itself is one big innovation. Then we had a lot of energy devices to make the surgery bloodless, faster. We have the advancements in anesthesia workstations, which give us a lot more information to be able to manage them better during this. And the fact that we are not scared to keep the patient on a ventilator for a day, just to ensure that the recovery takes in the right manner. Some people may take a little longer. We need to give them time. Previously, we used to get scared as surgeons. If my anesthetist said the patient requires ventilator, my stress would go up.
Correct.
But now even we have understood well that no, this is required. And we have seen them recover so well. So that gives us the confidence. If we are confident, we are able to infuse confidence in our patients.
Absolutely.
So when it comes to bariatric surgery, it is important that we prepare them well and take them up. Now, complications of bariatric surgery what is bariatric surgery? We are working on the stomach and intestines. So that is as good as the gastrointestinal surgery. We have been doing gastrointestinal surgeries for decades, more than a century now. So whatever is the complications that can happen there can happen here.
Yeah.
It's not that it's very different, but the amount of focus, the way we have worked on our skills, on a lot of innovative products which have come by, they have definitely helped in bringing down the risk and complications of bariatric surgery.
So when I ask about risk or complication, as with any surgery, this comes with that set of complications.
Yes.
That's not the main concern here. The main concern for me, like for my audience, for our audience, is that what would happen after? Like, okay, I get my bariatric surgery done. What is it that I'm looking like? Okay, how much weight do I lose in how much time? And when will I get it all back if I don't maintain a certain lifestyle? So that is the question.
That's right. So many of the patients who come to me, they say, Dr. Saab, after the surgery, I will look like this. And I say, absolutely not. I don't remove 1 gram of fat from your body.
Yeah.
When I do a bariatric surgery, you're going to be just the same before and after. But look at yourself 1 month, 2, 3, 4, going on up to 12 to 15 months. You keep losing weight gradually.
Yeah.
Weight gain has been gradual. The loss also should be gradual. The body requires time to readjust to a new change that takes place in the body. It can't be drastic. Suddenly one day you can't run 10 kilometers. You will collapse there. So you have to build it up. That's the beauty of bariatric surgery, that you lose weight gradually. One. So what is it that you can expect? So we normally say you lose anywhere between 50 to 85% of the excess body weight. So whatever your normal weight should have been, say 70 kgs, you are say 100, you may lose between 15 to say 25 kgs of weight post bariatric surgery.
In what span of time?
In
15
about
to
1 year.
1 year.
12 to 15
months.
Yes. And another interesting thing is, Dr. Saab, so what do you do in bariatric surgery? You take the stomach and tie it. And I feel like, oh my God, I don't, tie gunny bags or anything like that. So it is that, yes, we reduce the size of the stomach as one part of the bariatric surgery. But there are many other components, removal of certain portion of the stomach which changes the feedback to the brain, and doing a bypass. That means we are now ensuring that whatever we consume, normally what happens once we take in food, it goes into the stomach, mixed with acid, goes further down the intestine. Here the bile and pancreatic juice comes, the intestinal juice. There's constant digestive process, breakdown, absorption going on. Now what is bypass? Bypass means that we make 2 separate components of the stomach, connect the intestines in such a way that the food enters one part of the stomach, goes into the intestine, which does not get the bile and pancreatic juice in that at all. The other part of the stomach, there it is connected to the bile and pancreatic juice. Now they come down and meet at a point. Now wherever they meet, that is when the digestion begins. So this much of the small intestine is bypassed. So if you have not given adequate time for food to be digested and absorbed, you obviously will not get those calories. Now, as you don't get calories, you also don't get all the nutrition. So that is where the question of nutrition comes. Yes. So the deficits are bound to happen if we do not take care. Now we know that the amount of food we take is very less, but we need so much of proteins, so much of minerals, vitamins, trace elements, micronutrients, all of them. If we consumed so much food, we would get correct quantities of all this.
Right.
Now the food has come down.
Correct.
But we need all these as well. That is why we need to give nutritional supplements, especially for the first year. And as the patients capacity to consume food comes back towards a healthy level, that which is required by the body, not more. We don't need additional nutrition. They will manage well with their daily nutrition.
So there is this very common thing of like, okay, you are, like you said, you're tying up the stomach. So my stomach size is coming down. I'm able to eat less nutrition. But later, after a year, I'm able to eat almost the same level of food that I used to eat before. So is my stomach expanding? What is happening?
Yes.
Is also a question.
Yes.
Yeah. So
stomach is an elastic organ. So if you want, you can expand it to any amount. So that is when there is some amount of dedication from the patient side that yes, you should follow the instructions, ensure that you don't go back to overeating and end up with again a size of the stomach which was normal. Then of course you will go back to your normal weight.
Yeah.
That was your normal. We made a new stomach for you. You should maintain it. I can bring your train on the railway lines. I can't keep it pushing it forever.
Yeah.
That job is yours. But I can show you what you should do, but you should follow that. So this is where, the difference actually takes place. So that is where, again, I say preparation is so important. Because having this clarity in the patient right from the beginning will help us ensuring that they are on the right track and they don't spoil your name. Because at the end of it, if they gain weight, they will only say, whom did you go to? Oh, Dr. Anil S. Mehta. That's it.
Yeah.
What mistake I did? No.
So there is no permanent weight loss procedure is what you're saying, Doc? Because we've seen that Ozempic is not permanent and it is not a miracle weight loss pill. We've seen that your balloon, that the gastric balloon that you've spoken about is also temporary.
Yes.
Bariatric surgery, your stomach can expand in size and it is also not a foolproof weight loss procedure.
But it is the only best permanent way of losing weight if you stick to all
the plan
and the instructions. And yes, let's assume that you do all that. We've seen that despite that, you could start regaining weight after about, say, 5 to 10 years. We have seen patients regaining weight after 10 years.
I have seen these two acquaintances gain weight in, I think, 1.5 to 2 years. Later, I think I saw them.
Then I think
because I saw her,
you should actually go look back as to what went wrong.
Yeah, because I could when this person had gotten the bariatric surgery, I could see that she was, I wouldn't say she was a foodie. I think for her it's also genetics. But then I saw she could not eat more than half an idli. Just plain half idli, not even like there's no accomplishing sambar chutney. There is just plain idli. She couldn't eat more than half. She was burping. She was saying, I can't eat more. I'm like, and I was surprised because where is your nutrition coming from? And she was not guided well also about the supplements she should be taking. She lost a lot of hair. So all of this. And then I joined my post-graduation or just finishing up. I'm not very, memory is not very sharp there. But when I saw her after 1.5, 2 years, she was pretty much back onto the same weight she was before she got in her bariatric surgery.
You should also ask in case she got the procedure reversed.
And I saw her eating 5-6 idlis again. So that's what I'm saying. So she probably, it can be extremely short-lived if you don't take proper care.
Absolutely. It is not that the doctor can do a permanent job on you. The doctor can only assist you.
Yeah.
The making weight loss permanent is purely in the hands of the patient. But our duty as surgeons, bariatric surgeons, is to ensure that we guide them well enough, handhold them, sometimes push them into doing the right things, making it clear what can go wrong and why they should take care. I think if they understand, they will do it well.
True. So what about, so this is again question in public interest, is that bariatric surgery is associated with a lot of deaths.
Yes.
So how do we substantiate that? Is bariatric surgery a high risky procedure? And what is the care one should take? I think we've already touched upon these things like very briefly, because there's still this doubt. Okay, bariatric surgery, and also there is a lot of confusion between liposuction and bariatric surgery.
Yeah.
Yeah, because when people come to me, I tell them like we do, because in our practice we have a plastic surgeon also on board, so we do very limited pocket areas of liposuction.
Absolutely.
Anything beyond that is in an OT, is in a proper like OT setup, and beyond that we send it to a bariatric surgery experts like you, doctor. So there is very different, liposuction. I always tell my patients it is not a fat loss procedure, it is an inch loss procedure, or it is a body contouring procedure.
Yes.
While bariatric surgery is more of like a weight loss, weight management surgery.
Yes.
So there is a lot of difference between injectable lipolysis that like you have a little
Correct.
pocket fat.
Yes.
We do injectable lipolysis. It will kill the fat there. It's a very small area that we treat, like your arms or your underarm fat or your. Then we also have cryolipolysis or RF way of contouring the fat, which is again pocket area of fat loss and fat contouring. Then there is liposuction where we are sucking away that excess fat, body contouring. Then you have your bariatric surgeries, and also there is this spectrum of things.
Correct.
So there is a misconception of liposuction and bariatric surgery firstly. And so to differentiate these two, and also tell me as a final note on bariatric surgery that is it that scary as what people are presuming it to be?
Yeah. So firstly, liposuction. So whenever a patient comes to me and they say, yes, you need surgery, so they immediately say, so liposuction.
Yes.
So that is how they have, because in their minds it is like, oh, I have a lot of fat and I need to remove the fat. So liposuction says that you suck out the fat, so I should have lost weight and I should be fine. So that is the most common interaction with the patient. So I have to start from there that, see, as you rightly said, liposuction is for small pockets, regional areas which deserve a little bit of contouring, not more than that. Because if you see correctly, it is the liposuction is actually having a lot of raw area, generating a lot of raw area.
Yeah.
And unlike bariatric surgery, where we are actually, it's really minimally invasive. It's not just the cut, it is what tissue damage you do within the body that matters a lot more. So, when I tell the patient, I said, see, liposuction is removal of fat, and you remove fat from a patient's body, the body will again make that fat. Why in first place did that fat come? So there is this hypothesis and a concept that you have a set point in the brain. Now when you have a set point in the brain and say, let's assume it is stuck at 100. Whatever you may do, it will take you to 100. So bariatric surgery is the only one where the feedback from the gut which goes post bariatric surgery to the brain brings down the set point. Say it is 100, it starts moving down at 99, 98, 95, 90, 85, 80, and as it moves down, the body sheds the fat and it comes to a new level. Now the body tries to maintain that new level. So body is now doing the job right. If you are not doing it right, the set point will go up again. So it is like this. If I hold your hand and suddenly pull you, you are going to resist and you will try to pull back. But if you offer your hand forward,
Willingly,
you are not going to resist.
Yeah.
So that is the difference. If you remove fat, body is going to make it. So that is liposuction. It should be limited to regional areas. And when you have obesity in general, bariatric surgery is the main answer, particularly if it is morbid obesity. And liposuction also cannot remove the metabolic fat. It can only remove the fat which is just under the skin, not inside your abdomen, not around the viscera, that is called as the visceral fat, and that is the metabolic fat. So this is something that really needs to be understood and with clarity in everyone's mind, so that you will not look out for something wrong. Second question of yours about deaths in following bariatric and metabolic surgeries. So I think what has happened is that this surgery was something new, where it was amazing to see that people who were huge after this surgery, in about a year's time, they shrunk so well. So it generated a lot of curiosity, and in that, and at that point of time, when we just sort of began, I think there have been some deaths. But what is surprising is it has not always been due to bariatric surgery only. Many of them have been due to extensive liposuction as well.
Yeah.
So the probably the clear picture has not been portrayed. So bariatric surgery took a big beating.
Yeah.
But if you see now, I think we are doing more than about 3 lakh bariatric surgeries in a year
Wow.
in India. I may be wrong in on the numbers, but it is huge. So why? Because today it is a very safe surgery. A lot of patients ask me about the safety part, the risk. So I tell them one thing. If you ask about the risk, I have taken the biggest risk in my life. I've operated on my wife's sister.
Oh, bariatric.
Bariatric surgery. That's the biggest risk in my life. If I was not sure about the safety, I wouldn't do it.
Yeah.
And I'm very clear, if I'm not going to do a particular surgery on any of my family member, I don't do on anyone else. Because God has been kind, but it is up to me to ensure I get a good night's sleep.
Yeah.
So that is bottom line when it comes to me, and that is the basic principles on which I've opened my new center called Serene Med Lounge.
Yes.
Yeah. So completing this bariatric deaths, yes. I don't think, if I look at the percentage of bariatric surgery deaths vis-a-vis other GI surgery deaths, for various reasons, I don't think there is any great difference. In fact, I think the percentage of deaths post-bariatric surgeries is much lesser than other GI surgeries. Now there is a catch here. The GI surgeries are done for diseases, maybe cancer, maybe other things. So people ask, but this is a normal person. I think we are wrong in the most basic point. Why do we consider obesity as normal?
Yeah.
That is why we live with it. If you look at it, even cancers well treated, or even if untreated, can give you a long length of life. Take prostate cancer for that matter. You will live for years and years, sometimes unnoticed. Obesity also, you do that. But what happens in the end?
Yeah.
You suffer all the complications and consequences of obesity.
Yeah.
So it is a disease. It's a slow progressive disease. Obesity is a disease, and it is not just a disease. Obesity is a bag of diseases.
Like this very nice friend who invites a lot of people, like, it's this very sweet person who has a lot of friends. So I would say diabetes, obesity are these very good, sweet people who attract a lot of people around them.
Absolutely.
Yeah.
So obesity is a bag of diseases, and once it sets in, it just calls all its friends.
Everyone, yeah.
Yes.
So
And the beauty is, now you have a person who has excess weight, he's developed diabetes, BP, thyroid, hyperuricemia, PCOD, infertility, many things. Now you go on individually treating each one of them. And the core is here.
You're only treating the symptoms and not the disease.
So you still have the main cause for this problem. But if you treat obesity, all this could vanish permanently.
True.
May not fully, because every change in our body need not be completely reversible. Some changes are irreversible.
Yeah.
So to the extent that whatever is reversible at least will go away. And I've seen many of my patients post-bariatric are no longer diabetic.
Yeah.
And they are free from so many other comorbid conditions. I have my patients who have come to me after about 2 years or so with a child. and you should see the glow on their face. It's amazing. So I think it's very important to understand that obesity should not be taken
Very light.
lightly. It is a disease, and when you say it is a disease, if someone develops a disease, like say for example cancer or anything else, we have a general tendency to say that you did this, that's why you got this. Being judgmental is something that I think we should step away from.
I think that's why a lot of patients or people also don't seek treatment with the fear of being judged, with the fear of being counseled and corrected, instead of just accepting their problem as ours and trying to give them a rightful solution. I think it's the constant fear of being judged is also pushing them to that, like you said, the obesity corner more and more. Yeah, I also tell this to my patients, Doc. Most of the times we're only looking at addressing the symptoms.
Correct.
There is a leaky tap and your floor is wet. You're only mopping the floor without addressing the leaky tap. You're never going to have a clean, dry floor. So you have to look at why the tap is leaking and fix it first. And then automatically you're going to have a dry floor sooner or later.
Very true.
So it's very important for us to look at the disease and to take obesity more seriously and to be treating it as early as we can.
Absolutely.
Because I hear sometimes when patients come with overweight children, like the children are overweight and they have a lot of problems. As simple as, I would say acne is the least problems. So that's why I'm saying simple. But for them, it is a big problem.
Yes.
So if they come with that, I tell them, this is the thing, this has to be fixed. They're still very young. They'll let them go. No.
No. It's time to, change the way we think.
So Doc, now we know that with bariatric surgery also, it's not a permanent procedure, right? So can bariatric surgery be done over and over?
Yeah. So I wouldn't accept when you say that it is not a permanent procedure.
If
it
you
can
don't
be made
permanent,
yes,
but
made
in
permanent.
case if someone is not focusing on maintaining,
correct, they could definitely regain it.
Okay.
And whether it can be done again and again, it certainly can. So I had one patient who underwent first liposuction for weight loss and got back all the fat.
Yeah.
Then the band came in, the gastric bands?
Yes.
So he underwent band surgery and every time he lost weight, again regained. And following that, then the band gave little trouble, so he underwent another surgery to remove the band. Then he underwent a type of bariatric surgery called sleeve gastrectomy. So the stomach size was reduced. He lost weight, again regained, then came to me. So I told him one thing. Look, I went through in detail as I always do. I told him, look, you have spoiled the name of 4 doctors, and now I am coming as the 5th one in your list. I am not ready for that. You have to first show me that you are going to be very persistent in your lifestyle changes that I suggest. The exercising, the diet, and sticking to all the instructions to ensure that you actually change your lifestyle for good. And most importantly is that I observed that I would like to wait until they start enjoying that lifestyle. Then it becomes permanent.
And then you know that they are able to sustain it.
Yes. Because once you enjoy, you're going to stick to it.
Yeah.
So I pushed him for 1 year. I said no. Finally, after 1 year, I did again a sleeve gastrectomy on him. Until date, he's not put on weight again. His sugars are under good control, and he's doing well. So bariatric surgery also can be repeated. But then one thing that we have seen is the benefits of a resurgery, a revision surgery that we call, are not very consistent in their outcomes. I think our understanding there, probably we need a lot more inputs, and I guess that we'll get only when we do more and more revision surgeries. And we are seeing that a lot of patients are coming for revision surgery. So I think in the next about a decade, we should have more information about what needs to be done in a revision surgery. But yes, it can be done.
Okay. So you mentioned sleeve technique.
Yes.
Can you take us through the different types of bariatric surgery that are out there?
Yes.
And the safest or the best and easiest way to the most complicated way, if
Right.
there is, yeah.
So band surgeries are no longer done as pure band surgeries. No, we may have this as an accessory, as an additional component to the present genre of bariatric surgeries. So one of the commonest is in the world even now is sleeve gastrectomy. So
Okay.
what do we do in that is to reduce the size of the stomach without altering the rest of the anatomy.
Okay.
So the stomach continues as the small intestine and thereby large intestine.
There's
We
no
have-
bypass, you mean?
There's
to say.
no bypass. So there is another that is bypass. Now bypass, what happens is, as I told you, we make the stomach into two compartments,
Okay.
dissociated from each other. One compartment continues as the small intestine, and the other compartment gets part of the intestine which is cut at a particular point and brought and attached to this. And the other distal cut, we again reattach to the small intestine, between the two small intestines, so that the loop is maintained. The food goes through one part of the intestine, the digestive enzymes go through the one part of the intestine, meet up at a point, and then it's a normal one. That's a bypass surgery. From here we have plenty of variations, and we also now have started what is known as sleeve plus surgeries, where we maintain the anatomy despite having a bypass. So
Okay.
we don't split the intestine, but we just bring a loop and attach it here, so that the food can get bypassed directly, and the intestinal juice, the bile and pancreatic juice comes and joins it. So there are a lot of variations, and now that we have much more in our the ammunition in our hands, it makes it that much more difficult, but it also gives us that much more opportunity to see what may be more and more suitable to individual patients. So that is where all the details of the patients help us in deciding what might be more suitable. For example, some patients they just love food so much that they can't just give up. So that's when we do bypass surgeries, particularly a type of bypass surgery where they can have food but will still lose weight. That may sound very interesting, but there's a catch.
Yeah, always.
So we allow them to eat, but when they overeat, they will end up with increased frequency of stools. So now they have to manage what they like.
Yeah.
They want to overeat and suffer this, or they don't want this.
So they undereat or
not undereat.
eat optimum. Yeah.
So you still can eat like a normal person, or I wouldn't say normal person, because normal person eating has become a very a big question mark in itself. A lot of people, they think that by reducing the quantity of food they will lose weight. Yes, they do, but it is not the right way. As I told you, it leads you to weakness. And I said, don't reduce the quantity of food, alter the quality of food. Then I made further change, because I realized that when I say don't reduce the quantity of food, they still continue to overeat. So now I said, don't overeat, just eat as much required by the body. And the rule, which has been there since ages, that once your stomach is 80% full, please stop. I think that is one of the most apt rule to be followed. That is normal.
Yeah.
We have changed the rules of normal. I think we should just get back. So they can eat normal and yet lose weight, yet get the metabolic syndrome corrected. But that can have a little more of nutritional side effects, because when you bypass, the absorption definitely matters. There are certain areas where certain components of food are absorbed, and if we are bypassing them, then we land in trouble. So we have to keep a very close watch on the nutrition of a post-bariatric patient.
Yeah.
So we have a very regular follow-up with them, and at pre-decided intervals where we check for different aspects of the nutrition. So for example, their proteins, their iron content, their various vitamin levels, and sometimes even the trace elements. If you find that something is not going right, then we'll hunt for them. What might be wrong? What is the kind of food they're consuming? Are they missing on something? So now what we have done is, when we give them supplements of proteins, we have tried to bring all these components into it, so that if there's anything that is not being consumed, at least this will provide it. And if you are able to manage them well for a year, I think there should be no
That should be
issues.
good to
They
go.
should be able to manage very well post bariatric surgery.
Yeah, makes sense. So one quick question again, we'll touch upon this very quickly, that post bariatric surgery or post significant amount of weight loss, there is a lot of other stuff to deal with, is the post weight loss body, the skin laxity,
Yes.
stretch marks that come with it. So how are you dealing with those?
Yes.
When patient complains?
So here it's my observation that the younger the patient, their ability for the skin to contract is definitely higher.
Yeah.
The older the patient, it is much lesser. So what I normally do is, the moment, say they've crossed about a month or so, 1 month and a half, I start using pressure garments, and I tell them to also give a good massage. Now when you give a good massage, you should be sure, and you should understand that it should always be towards the heart. Many a times they massage from top to bottom. They are actually pushing the skin into more,
Yeah.
you're pulling, say stretching the skin more. So that should not be done. And so during this course of 12 to 15 months, when you're losing weight, if we are able to also ensure we manage preventing the stretch to the extent possible, manage to get the skin to contract to as much as possible as the individual's capacity, particularly depending on age, we're able to tackle a relatively moderate weight loss. But when it is in excess, where they had a huge amount of fat,
Yeah.
the skin has already stretched so much,
Yeah.
and when they lose that, and they want to lose that fat, so when you lose, you are definitely left with a loose skin
Yes.
and whatever little fat in that. So in such a case, you definitely need cosmetic surgery,
Yeah.
where I've had patients where we have removed the skin and as a complete belt,
Like a tummy
which
tuck.
means no, tummy tuck is only in
Only
the
this
front.
much, but then the
I've
whole
removed all around.
all around.
So this much of skin and fat all around.
Mm.
So can you imagine that? At that point of time, the patient is literally looking like
Yeah.
half to a different house. But the beauty of that is, post that surgery, and the entire line of suturing is within that of the patient's innerwear.
Mm.
So
It's
now the
concealed.
patient has absolutely no marks on the
Yeah.
tummy, a flat tummy, no love handles anymore,
Yeah.
and they feel amazingly good.
Yes.
But that, yes, they need. Now similar with the hands and the thighs and the buttocks, all these need to be pulled up. But that is for excess. For, I think, where it is moderate, I think I have a simple solution: send them to you.
Yeah, but the thing is, expectations also has to be set, because when there is sudden
Yes.
drastic weight, it's impossible for us to set the tone to a complete, like have a completely tighter and touter
Correct.
skin. And stretch marks also, doc, people come with expectations that stretch marks will be fully erased.
Yeah,
So we
doesn't.
always tell them that with the best of the best treatments and technologies from all over the world also, we'll be able to address stretch marks to 40 to 60%,
Okay.
not beyond that. And that too, when you start to treat, is also very important.
Very important. True.
So it's not fully possible to 100% treat stretch marks. I think there are some things that are permanent and we cannot have unrealistic expectations. So when somebody is losing weight gradually is when we tell them come for skin
Yes.
tightening procedures, get regular massages that sets the tone of your skin proper well. So gradual weight loss, we will still be able to manage a little
Absolutely.
bit of the skin tone. But stretch marks, even the best, I combine 6 to 7 technologies and treatments together to address conditions like scars and stretch marks. But even then, 17 very fair skin individuals whose recovery rates are very high, we see a result of 80-85%, but
Correct.
nothing beyond that
Absolutely.
even in them.
No,
So
it is
you're pushing
true.
your problem to us. You're like, I've
I'm
taken care
sure
of your
here,
weight, now you take.
I'm sure here both of us are happy.
Yeah. Because we are like, okay, see, you amazing that you've lost weight and you are
Yeah.
able to get on with your life more confidently, and that's what is most important, right? ये stretch marks तो रहने दो now, I'll leave it. That is that.
True.
Okay, I think that was such an intense deep dive into obesity and the treatments for obesity. So now let's move on to a little bit of fun segment.
All right.
Okay, so okay, doc. So the rapid fire. Okay, now very quick answers. Okay.
All right.
So one myth about obesity you wish would disappear.
That obesity is, oh, he's very healthy or she is very healthy. It is not a disease. It is a disease. And please don't be judgmental.
Yeah. So do doctors and medical industry benefit from keeping people overweight?
I think always they will benefit, but look at the other side. If you are going to be so busy, what happens to your own quality of life? So finally, we really don't benefit. We also should be able to live a comfortable life. That is possible if most people around you are healthy. So I would say no. If you go to the far-reaching consequences, you do not benefit. Medical companies may benefit.
Yes.
Yeah.
And we all
But-
know what kind of practices are happening to
Yes.
keep people overweight also.
Absolutely.
Which is why we say as a consumer, you should be extremely smart with what you consume and how you consume.
Right.
Yeah.
Agreed.
So are weight loss surgeries just an easy way out for people who don't want to diet and exercise?
It is not for them. It's definitely an easy way to lose weight and regain it back.
Yeah.
That much easier to regain it back if you do not want to exercise and diet.
Okay. One medical advancement that has truly made an impact according to you in treating obesity?
Laparoscopy. I think it is the one, if I see last 5 decades, it is the number one that has really changed. And because of laparoscopy, we have had a lot many other accessories which has helped. You know, the energy devices, the robotics, everything has only made the surgeries more and more minimally invasive, very less tissue trauma, and much quick recovery. I am sure we should see a day when most of the surgeries will be daycare, walk in, walk out.
Yeah. So a food you love but wish it was healthier.
Sweets.
Which one? Like
Which one? Oh,
what's your
I-
favorite sweet? I think your son can answer this. What's
Maybe.
your dad's favorite sweet? No.
which is not. That is the problem.
Rabdi.
Rabdi.
Ah.
Yes.
But how can you make it healthier, no?
So
Can't.
there's one way of making it healthier.
Huh.
Don't eat. Taste it. Keep it in your mouth for long, as long as you want to
Just
enjoy
savor
it.
the
Savor it,
flavor.
savor it. And most importantly,
Huh.
this is one place where most people make a mistake. You have consumed it. It will have some negative effects. And after that, you're so stressed about it. That has 100 times more negative effect than. So if you have enjoyed it, leave it at
Leave
that.
it at that.
Enjoy, live it. Don't now
Over.
overthink about it.
Okay. What's one food you wish everyone should stop eating for the sake of their gut and obesity in general?
Processed foods. I would say any processed foods. A lot of patients ask me, what is the best diet? I have a very simple answer for this. Go back to your grandparents' diet.
Yes.
You
True.
carry the genes to digest that kind of diet. You carry the genes which are dependent on that diet. Okay. And it was a very healthy diet. They were healthy. They were good. They lived long enough. Yes, so then they say that no, the kind of food that you get today, that environment is not there. You can't do anything about that. But what you can do, at least do that.
Yeah. True.
We are limited by what we can do.
So what's your take on cheat meals?
Very essential.
Essential?
Absolutely. See, when you look at health, you have physical health and mental health. I won't go to many more aspects. I combine emotional and all that into mental health.
Right. Understood.
So, if I were to go on a very strict diet, say I just give up sweets completely, I'll give up. How long? Sometime I might just succumb to it.
Yeah.
The day I succumb, I will make up for all the days and months and years that I have not had. So, I'm at a total loss. I would rather do one thing. I have a 80-20 rule for this.
Yes.
80% whatever you have should be for your body, physical health. 20% for what your brain wants.
Yeah.
It is essential. But this comes with one condition. Anywhere terms and conditions apply.
Always.
Yes.
Like I said, there's a catch, there is TNC always.
The condition is you will not touch the 20% until you have finished 80%. And you're done.
And you're done.
Once your stomach is full, you will not overeat what your brain wants. Okay?
Yeah.
And if you are, if you can focus on tasting and enjoying it rather than eating the unhealthy food, I think you're good.
You're good.
One. Secondly, if you go back many decades now, we've all been, in India it has never been that we were so much particular about the hygiene that we follow today. We have aped the Western countries. In that, I think we have also lost the immunity.
Yeah, 100%.
There is a component of a bit of contamination which actually keeps our immunity strong, and a continuation of that keeps it alive. So I think that cheat meal, which can include snacks and charts and whatever,
rabdi.
and rabdi of course, should be continued so that we are able to take care of our gut as well. Today we have a lot of gut imbalance issues. That's another topic which is an amazing topic, because we are also learning a lot now while we are able to treat patients, that we staying in India and not having gone to the Western countries, still we are losing all the benefits of having stayed in India.
Yeah. We are westernizing everything in India.
Everything in India. So we should continue with the 20% cheat meals, where we will also have some of these contaminations, which will keep our gut alive, gut immunity alive.
Yeah.
And that's the way to keep the gut balance right. The second way to keep gut balance alive is please manage your stress.
Yeah.
There is the gut brain.
Yes.
If you are disturbed here, it will be disturbed there.
And everything gets disturbed.
Then
So for me, my take on this cheat meals is I have patients or clients who do extremes. So that's why 80-20 rule is a better way to put it than having a cheat day or a cheat meal, because that meal, they really cheat.
They really know.
Really cheat. So I think the balance is very important for long-term sustenance.
Absolutely.
If you're looking at a short-term program, I think it is okay. But if you're looking at a lifelong lifestyle change that has to happen, it's good to be this 80-20, and you rightly said do that 80 and then look at
that's
the 20.
the condition. We should. So I always tell, don't forget the condition.
Don't forget the condition. And the 20 also can't be everything together. It has to, I feel it has to be like scattered around in between this 80. You can't like eat, okay, like say like 20 days in a month I'm eating and the 10 days I am. Because people do that cheat.
Correct.
Thing.
So, so the other condition in this is that this 80-20 applies to a single meal. It can't be that, as you said, okay, 6 days in a week, I will diet.
Very strict, and then
one Sunday, I finish off
no
whatever
holds
good
barred.
I've done. No.
Yeah, that
Yes.
also has to be optimized.
Very, very true.
So that was for the episode, guys. I hope it was useful and informative to all of you, and that's always what we want to bring out to our viewers. If you enjoyed the video, do subscribe to our channel, share it with all your family and friends to understand the gravity of obesity and what one needs to be doing to address it accurately. So until the next episode, yours holistically, Dr. Priyanka Reddy.